We have spent a lot of time talking about economic policy and social welfare policy and the budget, and it's all about spending and taking care of people and all that kind of stuff. And today, to finish up Unit 4, we are just going to run through a bunch of other different types of policies today. So we'll be dealing with some healthcare, some environmental policy, some energy policy, and finally, we'll run through some foreign policy decision makers. Our last objective for Unit 4, we are going to describe different types of public policy. So like I said, healthcare, environmental policy, energy policy, things like that. We're going to look at all sorts of different policies that are in place, and we will explain the ideological disagreement about these policies. So we'll talk about what liberals think about these policies, what conservatives think about these policies. First up today, we're going to talk about healthcare policy in the United States. So we're going to look at the situation about. We're going to be talking about like cost of healthcare, about access to healthcare, and just some general like unique things about the United States and how we deal with providing healthcare to people. The first thing to know about healthcare in the United States is that healthcare is incredibly expensive here. Not just for you, the person, but for the country overall. Healthcare accounts for like 20% of the nation's total GDP. So, like one out of every $5 in the whole economy is healthcare related. The United States spends more on healthcare than any other advanced economy in the world. We don't have better outcomes for all that spending that we do. In general, we pay more for healthcare and we receive less healthcare than other countries like us. Healthcare costs, a lot of the things we've talked about, like Medicare and Medicaid, healthcare costs are part of what makes it incredibly difficult to have a balanced budget. There's quite a few reasons for that. One of them being that the United States is one of the only places that allows for-profit healthcare in the country, in the world. And so that means that a lot of companies, like they want to come here because they can make money here. And so this is where a lot of the research is done because like you can develop new technology and new drugs, and then you can make profit off of those here. Since our healthcare system is profit based, healthcare companies like providers like hospital chains and stuff like that, they overbuild. They make things fancy so that they can generate more profit and stuff like that. Often they build more than there is actual demand for. The other thing is we use private health insurance companies. So, like when I go to the doctor, I pay like the same amount all the time. My health insurance company pays for the rest of it. So, like, there's no incentive for me as a customer to even consider like something that would be less expensive. I just do whatever because I'm not the one paying for it. So, like, our incentive system is also weird. Doctors, the other side of this, they get paid for whatever they do. So they don't like try to find the most like efficient care either. Like you may go to the doctor's office and they'll do like 10 tests just to be safe because the doctor doesn't care. They're going to get paid back for whatever they do. And then the other problem here is we have so many people in this country without health insurance. We have millions of people that are still uninsured, and those people still get health care. So when they get health care, it means that the rest of us are chipping in to pay for that. And these wouldn't be problems if we had a more like government driven healthcare system like other states around us because we'd be better able to control costs. But the system that we use in America means that most Americans have to have private insurance that they get from their job. Like, I have insurance that I get from Shelby County Schools. So that's part of my compensation for working there. If you don't work for a company, like you work by yourself, you have to find your own health insurance plan. And you can get these from insurance companies, but it costs a lot more. Like, for me, I get to split the cost with my company. But if you're like self employed, you have to pay both sides of that. We know old people get Medicare, and we know that people who like don't have the means to pay for health insurance get health care through Medicaid. We still have millions of people in the country without health insurance. Almost 30 million people in this country don't have health insurance. A lot of them are young people, and young people tend to be healthier. So, like, they don't have health insurance because they feel like they don't need it. I was certainly like that when I first got out of college. I was like working a job at a restaurant. They didn't offer health insurance. So like I didn't go buy health insurance because I had other bills to pay. So this is the case. Like a lot of our young people in their early 20s don't have health insurance. Um, Most people that are uninsured, they are like they're working and they just happen to work for companies that don't help them obtain health insurance. Being uninsured, like a lot of other problems we've looked at, disproportionately impact non-white Americans. Um, and it also is going to be a problem for people who like they make they make too much money to qualify for Medicaid, but they still make barely enough money to meet their basic needs. So like they might work for like small companies, or they may not earn enough money to like buy health insurance. So we've got like millions and millions of people in the country that are uninsured, and so they lack basic health care, and that makes health outcomes worse for everyone else. Medicare, we've talked a lot about while we were talking about the budget. Medicare covers everybody over the age of 65. It covers about 17% of the population. This is the biggest health insurance company in the world, and it's run by the government. This is funded by a payroll tax like Social Security, so I pay half and my employer pays half. And this is the fastest growing part of the budget. Healthcare costs are getting more and more expensive all the time. And we've talked a lot about how Social Security will start paying out more money than it brings in. Medicare is already doing that. Medicare is already spending more money than this payroll tax pays for. There's different versions of Medicare. The first part, Medicare Part A, is what everyone automatically gets when they're 65. This pays for old people to go to the hospital. Medicare Part B is an optional plan that people buy to help them pay for doctor's visits. So, like when it's not like a hospital type problem. Medicare Part D is a new part, and it's another thing that people buy, and it helps cover the cost of prescription drugs. So, if you're able to do Medicare Part A, B, and D, then you've got most of your healthcare needs met by this government provided health insurance. But there's a lot of problems with Medicare. Like it is very expensive, and it's hard to like bring the cost down without getting rid of some benefits. And it's hard to get rid of benefits because old people are a strong political force. They vote all the time. Interest groups like AARP make sure that Medicare is a really useful program with lots of benefits. This is another weird thing. Congress passed a law that prevents Medicare from negotiating for cheaper rates. This is how insurance companies work. Like an insurance company um, might have like thousands and thousands of customers, and they negotiate with doctors and hospitals for cheaper rates, and then the insurance company pays those cheaper rates. Medicare is prevented from negotiating, even though it's the biggest health insurance company provider in the country, and so that's a big problem. That's one of the reasons that the costs are so high, and it's one of the reasons why Medicare's trust fund is expected to be out of money by the end of this decade. Medicaid is just like Medicare, except it is for people with limited income. The difference here is Medicaid is a means tested program instead of Medicare being an entitlement program. Remember, everyone qualifies for an entitlement program, but people qualify for Medicare because they meet a specific need, and in this case, it would be income based. This is left up to the states, so who gets Medicaid is different in each state, and so this makes for some uneven healthcare access in the different states. The other big healthcare issue would be the Affordable Care Act, or what we have kind of colloquially called Obamacare. This was like healthcare reforms that started in 2010. They started rolling out piece by piece here. And this mostly started by like setting guidelines for what insurance companies have to cover, like what kind of plans they have to have and how to provide service to people. So this also like expanded access to healthcare because this would make states responsible for selling health insurance to people who couldn't get it through their job. So now, like, if I were working in a restaurant and I was in my early 20s today, then I'd be able to access health insurance by buying it through the state of Tennessee. It also was expanded Medicaid, which the federal government promised to pay for, but that decision was left up to the states. Here we can see the states that have chosen to expand Medicaid, and that means that more people who like don't have the financial means get expanded access to healthcare. So, like, the state is providing healthcare to these people. The states in blue have chosen to expand Medicaid, and it's paid for by the federal government, not the states. The states in yellow have chosen not to expand Medicaid. Now, what is weird about this is that since the national government pays for the Medicaid expansion, the states in yellow are still paying. Like, all the people there pay taxes. In Tennessee, here, we pay taxes that fund Medicaid in all of the blue states, but our political leadership here in the state have refused to expand Medicaid. And so this is a big political issue in these states that have refused to expand so far. They're really wasting a lot of money here, and it causes a lot of healthcare problems in the state because the state ends up missing money. Like in Tennessee, we've closed dozens of rural hospitals all across Tennessee, so less and less people have access to healthcare. Some of the other stuff that the Affordable Care Act did was it prevented health insurance companies from denying coverage based on pre-existing conditions. This meant that when you got health insurance for the first time, like when you started a new health insurance plan, they would cover any health issue that you didn't already have. This made it impossible for people to get coverage for like long-term health problems that they had. It made it very difficult for people to switch jobs because usually switching jobs mean you switch healthcare. Another thing here is it allowed young people, this will be important for you guys. Young people get to stay on their parents' health insurance until they're at age 26. I got kicked off of my parents' health insurance when I was 22. This forced all businesses that had 50 employees to offer health insurance to their employees. So this really expanded access to healthcare for people who didn't have it before. All right, so that's just a quick run through of healthcare policy. So that definitely doesn't cover all of the issues with healthcare in the country, but just a little bit of the few things that we might be asked about. So now we're going to switch over and look at the environment and energy policy.